Hello, everyone, and welcome to another Rush Generations Health and Wellness Lecture. Rush Generations is delighted to be your source of information, resources, and health promotion programs that help to maximize your well-being and good health as you age. Today is Wednesday, November 29th, 2023, and my name is Kim Morley. I'm a Rush Generations Program Coordinator. I will be your moderator for today's lecture, COVID-19, Cold and Flu Health. This topic is particularly important as winter is the prime cold and flu season, and feeling sick can be especially concerning with different bacteria and viruses going on and not knowing what you may be stricken with. And we also want to try and keep you as healthy as possible throughout this winter season. So for today's lecture, we are delighted to have two esteemed Rush colleagues speaking on this important topic. Before I introduce our speakers for today, I'd like to first thank Hannah Weitzman for helping with the production of this lecture and all of the behind-the-scenes work she does to make these lectures run so smoothly. As she normally does, Hannah will begin by helping us manage the chat and other key aspects so that we have a great discussion. As you know, we're live streaming this lecture via our YouTube channel, where we have dozens of other health education lectures that you can always refer back to or send to friends, family, colleagues that would also benefit from this valuable information our speakers offer every other week. We also use the video platform Zoom, which allows us to host a good number of people who join us via phone. For those of you on YouTube, we ask you to please use the chat function to ask your questions of today's speakers or to add to the discussion throughout our lecture. We will make sure that your comments and questions make it to today's presenters. And for those of you listening to the presentation via phone, you will also have the opportunity at the end of the lecture to unmute yourself and ask questions. And today's lecture will be a slightly different format where we will start with the COVID-19 discussion and presentation and have a question and answer portion at the end of that. And then we'll transition to talking about cold and flu health, and then have a question and answer portion at the end of that. We greatly appreciate you joining us today. And please know that, as we always remind you, that the information offered here is for general information purposes only, and that for situations specific to yourself, we encourage you to always seek additional medical advice so that your specific needs are met. Now, I'm delighted to introduce you to today's speakers. First, we'll hear from Dr. John Segretti, who graduated from Rush Medical College in 1990. Dr. Segretti did his residency in internal medicine and a fellowship in infectious diseases at Rush. He has been an attending at Rush since 1986. Dr. Segretti is currently a hospital epidemiologist here at Rush Medical Center. And then after Dr. Segretti, we'll hear from Dr. Michelle Sweet. She is an associate professor in the Division of Hospital Medicine at Rush. Dr. Sweet has routinely cared for hospitalized patients at Rush since completing her residency, which she also did here at Rush. She is also actively involved in teaching medical students and runs 3 courses for senior medical students. Dr. Sweet's expertise and research are related to the transition from medical student to resident physician. We are so delighted to have you, Dr. Segretti and Dr. Sweet, talking with our Rush Generations community today. And I will hand it over to you now, Dr. Segretti.
Hi, thanks again for that introduction, and hopefully give you some helpful information today on COVID COVID-19 update. I think that people have this misconception that since the pandemic is over, COVID-19 is gone, and that's not true. That COVID-19 has continued to be present and has caused minor waves of increased activity. If I could have the first slide, please. Next slide. These are data from, oh, next, yes. These are data from CDC. They're a little old. They're about 2 weeks old. But these are, this is what CDC is now following in terms of trying to determine whether or not there are any issues and trying to make plans for patients who get sick with COVID-19. The early indicators are test positivity and emergency department visits. And you can see that the test positivity has actually been fairly low, but it has increased a little bit in the time period. And emergency department visits have increased slightly as well. So it does look like there might be maybe a moderate increase in COVID-19 activity. More importantly are the severity indicators, because that is an indicator of how sick people are and how much stress the COVID-19 is putting on the healthcare system. And yeah, hospitalizations have actually been pretty low, but we did see a little bit of an increase, and we have seen a little bit of an increase in hospitalizations at Russia as well. Over the last 4 to 6 months, we've been averaging about 10 inpatients per day, and we're up to about 12 to 14 inpatients per day. So we are seeing a little more activity in hospitalizations, but nowhere near what we saw with the initial wave in March of 2020 and the Omicron wave of January of 2021. Deaths are also fairly low, but we are seeing a slight increase in deaths due to COVID-19 as well on a national basis. Next slide. This is to put things in perspective. This is a graph of new hospital admissions and COVID-19 hospital admissions per 100,000 people by week in Illinois that were reported to CDC. And in September of 2020, we saw a marked increase. And then in December of 2021, an even bigger increase related to Omicron. But we are seeing peaks and valleys throughout the time period. And currently, again, as of November 11th, 2023, we are seeing a little bit of an increase even here in Illinois. Next slide. And this is a graph of COVID-19 deaths and new COVID-19 admissions per 100,000 here in Illinois. And again, you see the big peaks in September and October of 2020, and then in December of 2021. And you can see that we are seeing since March, April of 2021, we haven't seen a lot of increase in deaths and hospital admissions, and they do tend to go a little up and down, but we are going up a little bit in terms of both deaths and hospital admissions due to COVID-19. Next slide. Now, a lot has been said about variants, and these are data from CDC, which monitors the different kinds of variants that are circulating. And during the summer, the main strain was something called XBB. And don't ask me how they name these variants, because it doesn't make any sense to me either. But the point is that these variants that are now circulating all seem to be offspring of Omicron, and and so we haven't seen any big shifts in the variants like we did with Omicron related to the previous variants. So that's probably one of the explanations why we're seeing a fairly constant number of infections and hospitalizations and deaths, but no striking increases. The fear is that a new variant will emerge that's different than Omicron, and everyone that's now immune to COVID-19 and especially the Omicron variant, then we would see an increase in number of cases, but more importantly, increased number of hospitalizations and deaths. So that's why the variants are being monitored. And so far, all of these variants, and there are lots of them that are circulating, are still descendants of Omicron. And so the current vaccine, and if you were infected with Omicron or one of its variants, you still can get infected, but you are protected from severe disease such as hospitalization and death. Next slide. And this is what's happening here at Rush. And these are data from just a few days ago, from 11/25/2023. And you can see the test positivity for COVID-19 is at 12%, up from 10% the previous week. Our influenza is 4.5% test positivity, up from 2%. And RSV is at 8.5%, down from 9.1%. There have been a lot of respiratory illnesses over the last month or so, and I think most of it has been RSV, and RSV is now again starting to decline. So even though this is primarily talking about COVID, RSV has been a big problem, especially last year, and especially in children and people over 65 years of age. We now have RSV vaccines that we strongly urge everyone over 65 and for children to get, to try to prevent RSV illness and severe disease. Next slide. Now, one of the things that's sometimes confusing is symptoms, and there are lots of different symptoms. Most people have fever, chills. Excuse me for a moment. Thanks, sorry about that. And every time I take a look at my news feeds, they're always talking about a new variant and new symptoms associated with a new variant. Well, that probably doesn't happen very much. The symptoms you still need to be mainly concerned about are fever, chills, cough, shortness of breath, difficulty breathing, fatigue. And quite honestly, you can't tell the difference from one variant to another with COVID. And you can't tell based on symptoms, whether it's COVID, whether it's influenza, or whether it's RSV. So that's why it's important that if you get sick, that you get tested. Next slide. Just to talk a little bit about prevention of COVID, but this would also include prevention of RSV and influenza, is stay up to date with your vaccinations. And the current vaccine for COVID is based on, it's a monovalent vaccine, which means only one variant type is in it. And it was the XBB variant that was circulating during the summer. And as I said, all the current variants are very closely related to XBB, and the current vaccine is expected to be effective against the current variants. And the major advantage of vaccination is, it does prevent some infection, but the major advantage of getting vaccinated is that it prevents severe disease and hospital and death, especially in people at high risk. And we'll talk a little bit more about high risk in a second. So stay up to date with your vaccinations. Avoid poorly ventilated indoor crowded spaces if you can, not always possible. Move indoor activities outside whenever possible, which again is not easy to do here in Chicago in the winter. But more importantly, if you get symptoms, get tested and stay at home. You don't want to infect coworkers. You don't want to infect people who are at high risk for severe disease, hospitalization, and death. If you test positive, what's recommended is that you isolate yourself for 5 days. But after 5 days, if your fever is gone and your symptoms are better, you can be around others if you wear a mask for an additional 5 days. If you're exposed to someone but you don't have any symptoms, monitor yourself for symptoms and wear a mask for 10 days. It's also recommended now that you get tested on day 6, and if positive, isolate yourself. If negative, continue to wear your mask until days 10. And just to clarify what these days are, if you're symptomatic, day 0 is the day that your symptoms start, not the day that you get tested. So if your symptoms start on a Sunday, you don't get tested until Tuesday, day 0 is Sunday. If you don't have any symptoms but are just test positive, then day 0 is the day that you tested yourself. So that's important, because sometimes people think that you've had symptoms since Sunday, but now you test yourself on Tuesday or Wednesday, that day 0 is Tuesday or Wednesday. It's a day that your symptoms start, no matter how minor the symptoms are. If you're high risk, you should seek treatment, because many of the treatments that are currently available are also helpful in preventing hospitalization and severe disease, and such as being put on a ventilator and dying. Next slide. And what are severe symptoms? Primarily respiratory, trouble breathing, chest pain, confusion. If you have severe symptoms, you should seek medical attention. If you have a fever, you feel fatigued, you have muscle aches, a cough, but you're breathing okay, you're not confused, you don't have chest pain, most of the time that can be, the vast majority of people do not require hospitalization. And what puts you at high risk? Well, there's a long list. I've put down the ones that you're more likely to see, and it's age over 65, immunosuppression, and there's a very broad definition for immunosuppression. You're on steroids, you're getting cancer chemotherapy, you're getting monoclonal antibodies for autoimmune diseases. That would make you immunosuppressed. If you have any heart or lung disease, such as congestive heart failure, COPD, or asthma, you're at much greater risk of having severe disease. If you're diabetic, if you have kidney or liver failure, if you're obese with a BMI of over 30, then you're also at higher risk of severe disease, and you should definitely seek medical attention if you test positive and you're at high risk. Next slide. In terms of treatment, these are the most common drugs that are currently available. You have Paxlovid. The advantage of Paxlovid is that it's oral, can be given as an outpatient. The downside is that you have a lot of drug interactions, and so you and your doctor have to go over what medications you're currently on and whether it's safe or not to take Paxlovid. Remdesivir is another drug that has been used successfully in treating COVID-19 and also in preventing hospitalizations and death. The problem with remdesivir, it's for 3 days, and it's as an outpatient, and it's intravenous. So logistically, it might be difficult to try to arrange for remdesivir. There's another oral drug, molnupiravir, which doesn't work as well as Paxlovid and remdesivir, but it doesn't have as many drug interactions, and it may be worth using when other treatments are not feasible. But again, you have to discuss this with your doctor. Early on, there were a number of monoclonal antibodies that were introduced, and they seem to work pretty well initially, but the Omicron variant seemed to be able to avoid the effect of the monoclonal antibodies. And since every one of the current variants is a descendant of Omicron, monoclonal antibodies are not expected to work against the current variants. Next slide. And I just want to finish up with talking about long COVID, which I think has concerned a lot of people. And some people who have been infected with COVID-19 can experience long-term effects, and that's what long COVID is, or post-COVID conditions. It's broadly defined as signs, symptoms, and conditions that continue or develop after acute COVID-19 infection. It's a very poorly understood syndrome, and may be more than one disease. Maybe autoimmune, and maybe some people might be effective virus. We still don't quite understand exactly why some people get it and other people don't, and what causes it. But it does seem to be more common in people that have had severe infection. That means they required hospitalization, being placed on a ventilator, or having severe pneumonia. It's also more common in people who are not vaccinated, and it's also more common in people with multiple reinfections. And unfortunately, we don't have any treatments for long COVID at this time. Next slide. So I think that concludes my presentation. on COVID-19 and be glad to take any questions that people might have.
Thank you so much, Dr. Segretti, for that wonderful and informative presentation. I know I learned a lot just because you hear so many different things, either in the news or, just people talking, and it's nice to get some, clarification. So I was really appreciative. For those of you who have called into the Zoom meeting, if you have any questions for Dr. Segretti, please feel free to unmute yourself by pressing *6, and we can answer your questions first. And then following that, we would love to hear from anybody listening on YouTube who has questions for Dr. Segretti. Oh, I see a caller unmuted themselves. Go ahead.
I just wanted to say thank you, Dr. Segretti. It's very helpful to have this information. Very grateful to you.
Oh, thank you.
Thank you as well. Can you hear me?
Yes.
Look, I was at the clinic, I won't mention it, but 1333, what do you call it, clinics, temporary, I can't think of the name of it, through Northwestern.
Okay.
Where they don't give you, I tend to get, due to colon problems and IBES, I was going to ask you about, if it seems like you and I have minor asthma, is it COVID? Could it be COVID, or could it just be, a minor virus, which they don't give antibiotics anymore?
Right.
So I was wondering if they should or it's immune to it, or
antibiotics do not work against any virus, and that's why the drugs that are used for treatment of viruses are antiviral drugs, and Paxlovid, Molnupiravir, Remdesivir are antiviral drugs. And there are other antiviral drugs like acyclovir that works against herpes simplex, but antibiotics like ampicillin, amoxicillin, erythromycin don't work against viruses.
Oh, okay. You just have to wait it out and sleep and drink, huh?
Well, that's why you should get tested, because if you test positive for influenza, there's an antiviral drug that you can take for influenza if you're high risk, and Dr. Sweet will likely talk about that. But if you test positive for COVID, there are treatment options that are available if you're an outpatient and high risk. If you're an inpatient, there are a whole other sets of drugs that can be used for people who are severely ill with COVID-19. But that's why it's important to get tested to see whether or not it's COVID or flu or RSV or or what or whatever it is, because
they don't always want to give you a COVID test unless you're in the emergency room.
Yes, and that's appropriate, because you can't tell by symptoms whether it's influenza or COVID or RSV or any
that's the problem.
Any other of the respiratory viruses. So it's important to get tested to try to figure out whether it's COVID, and if it is COVID, and you're high risk, there are treatments available.
Okay. It's hard to know what, it's like heartburn, it could be a heart attack, but it could be just acid reflux also, right? This is my problem.
Exactly. That's why you have to try to narrow down what it is so you can treat it appropriately.
But I'm saying, I don't know if those 5 minutes when they spend with you is enough time to really know. I took a urine specimen. Is that enough to know? There's so many things to test for. How do I know what they're going to test for?
That's why you have to see a doctor or another healthcare professional to be, so they can try to figure out which test is
Okay.
most appropriate.
Okay.
Dr.
Thank you.
Segretti, I did have a quick one. I'm
Sure.
currently on a biosimilar for
Yes.
ulcerative colitis. They just changed my medication to the biosimilar for Remicade.
Yeah.
I'm wondering, am I more susceptible because of that?
Well, if it's a biosimilar, according to the FDA, it works the same way. And whatever immunosuppression you got with the original drug, you'll get with the biosimilar. It's the same as generic drugs. You can get one drug that's a branded drug, and then generics come out, and usually they have the same side effects and issues that the branded drug has. So you should think of it the same way. And again, I'm not an expert on Remicade, but your rheumatologist should be able to tell you whether or not the biosimilar is reasonably the same as what the branded drug is.
Right. Well, my thing was I was on Entyvio before, and then they ramped me up to the biosimilar for Remicade, so it just makes me leery.
Well, again, I'm not an expert.
Entyvio just works locally.
Yeah, I'm not an expert on treatments with biological agents.
Well, thank you.
Thank you.
Thank
I
you so
have a
much.
question.
Okay, go ahead.
My question is, and I've been fully vaxxed, including the recent vaccine. I have had a mild case of COVID, and I want to know when I hear about this long COVID. I saw the main people who are mainly likely to get long COVID. But with that term long COVID, does it mean that, okay, you're getting symptoms and you're almost continually testing positive for COVID? That's what I don't understand.
Yeah, no, usually it's just the symptoms, and most of the people test negative for COVID. So again, whether it's an autoimmune reaction to the infection, that's still being worked out. And we don't totally understand what long COVID is. That's why it's such a broad definition of continued symptoms, even though it looks like you've recovered from the infection.
Yes. Okay. Thank you.
Thank you.
Thank you so much for those great questions. Those of you called in. We'll shift now to the YouTube questions that have appeared in our chat. The first one, Dr. Segretti, if someone has had all of the up-to-date vaccines, should they still wear a mask around others to prevent contracting COVID?
Yeah, that's a question that you have to answer for yourself, and it depends on how high a risk you have for severe disease. If you're over 65, if you're on immunosuppressive drugs, if you have heart and lung disease, that's an additional layer of protection in addition to the vaccination. And we do know that masking does help to prevent transmission. It's not 100%. And what's recommended that you wear the highest quality mask that you can tolerate for prolonged periods of time. And some people it's it's a regular mask, and some people it's an N95, and some people it's a N94. So you have to play around with what kind of mask you're able to tolerate, what fits comfortably, which one you can wear correctly, and you use the highest quality mask. The other thing that you can, and I'm glad you mentioned that because I forgot to talk about masking and prevention, and that is a huge part of prevention is wearing a mask when if you're going to be in an indoor situation with lots of people that has poor ventilation. Now, I don't know how you can tell whether or not the indoor facility has adequate ventilation or not. So I think you have to make that decision for yourself. And if you're at high risk for severe disease, then you should consider wearing a mask in those situations.
Yeah, thank you so much for that explanation. That really, helps decipher, how to approach masking and yeah, and you actually answered my follow-up question, which was going to be, what type of mask is the recommendation. So that was helpful too.
And in general, an N95 mask is better than a surgical or procedural mask, but not everyone can wear an N95. And if you can't wear an N95 because it fits very tightly and some people can have problems with breathing just from the mask, then you should wear the second best mask. And that's the current recommendation that we usually give people.
Yeah, that's great to know. Thank you. We have two additional questions. One is, if you take the COVID vaccination, should you also get the flu vaccine as well?
Yes, you certainly can, and we recommend that you do, because as Dr. Sweet will likely mention, influenza is still a big problem, and we are seeing an increase in influenza now, and there's pretty good evidence that taking the two together is not harmful, and even some evidence that taking the two together may boost the response to the other vaccine. So yes, you can take them together.
Yeah, that's great to know about even boosting the immunity. So yeah, thank you for that. And then the last question is, when you mentioned the treatments and the different medications, are these treatments available to people of all ages, and are they covered by insurance?
They're all of the medications that I mentioned have been FDA approved, so no longer emergency use authorization. So they are FDA approved, and you need to talk to your healthcare provider about how the medication should be given based on your age, your weight, and what other medications you're on. So, and the insurance question is always a difficult one, because most insurances will cover it, but there might be some insurance that don't cover those medications, and there might be a way to get them free through government agencies, but I'm not familiar with how to do that. So you have to look around, and you have to see what your insurance company will cover, and they're all a little different. It's not like it was last year or 2 years ago when the government basically picked up the tab for all of these medications. They no longer are doing that when they declared an end to the pandemic.
Yes, I know that. And that was my curiosity was, what do things look like with insurance coverage? But yeah, we're not expecting you to be an expert in in that part.
I get confused with insurance coverage myself, so I'm the last person you want to ask about that.
Yes, totally understand. Well, thank you so much, Dr. Segretti, for this COVID-19 update. It's really helpful for us to get this information, as we go into the winter season. So yes, thank you again for joining us today.
Thank you, and thanks for your questions. Thank you. Bye.
Welcome. And next we'll have Dr. Michelle Sweet join us to talk about cold and flu health. So I will hand things over to you, Dr. Sweet.
Great, thank you so much. So can you see my screen okay?
Yes, that looks great.
Great. So I will focus more on flu and cold, while Dr. Segretti, of course, focused more on COVID-19. So I want to focus a little bit more on some of the differences in diagnosis, prevention, and symptoms of flu and cold and how they present differently in different age groups, and stress the importance of accurate diagnosis so that we can effectively treat and contain the viruses. So I like to think about the different respiratory viruses as maybe three different kinds of pests in a garden. So rabbits, squirrels, raccoons. All of them may cause different kinds of trouble, and we would use different methods of handling each one. Likewise, COVID-19, the cold, and flu are three distinct illnesses, and knowing what you're dealing with can actually be quite beneficial. One reason is different illnesses require different treatments. So Dr. Segretti talked a little bit about COVID treatment. Common cold is actually caused by numerous different viruses, like rhinoviruses, and generally is mild and resolves on its own. Over-the-counter medications can help manage symptoms, but no viral treatments are usually offered. Whereas influenza is caused by an influenza virus and can be more severe, and antiviral medications can be beneficial, especially if started early, and annual vaccines are available. Diagnosis is important also to prevent spread to vulnerable individuals. Those who are older or who have underlying health conditions may be at higher risk for complications from COVID and the flu. And by diagnosing the correct illness, we can take correct precautions to protect everybody. From a public health standpoint, it's also important because the different illnesses have different isolation requirements. Dr. Segretti discussed the isolation requirements of COVID-19, in which case someone may need to isolate longer than someone with a cold to prevent spreading it with others. From a planning and resource standpoint, hospitals and clinics allocate resources based on illnesses circulating in the community. Again, Dr. Segretti gave some of that information, but knowing what's prevalent helps hospitals and medical clinics plan better how they're going to respond and allocate resources. It's also useful just for peace of mind, knowing what you're dealing with. If you're dealing with a common cold, you may feel relieved knowing it's not something more severe like COVID. So just like you'd handle the rabbits and squirrels and raccoons different in your garden, doctors often benefit knowing whether a patient has COVID, flu, or cold to provide best care. To make sure everyone gets right treatment, and so we can protect our patients, their family members, and the healthcare system can function most efficiently. So viruses each have their own unique way of causing trouble in our bodies. And like pests in a garden, each one is a little bit different approach to manage. So here I have some pictures of COVID-19, sorry, not of COVID-19, but of the flu and the common cold. The flu is, if you look at it, like a little ball with two types of spikes, H and N spikes. And these spikes allow it to enter and spread within our cells. The common cold is visualized as a simpler, smooth ball. It's less spiky, but still can be very sneaky. So I'm going to talk a little bit about transmission, which is how they spread. All three viruses spread through droplets when an infected person coughs, sneezes, or talks. If we're close by and we breathe in these droplets or they land on our face, we can get infected. We can also get infected by surfaces. If a virus lands on a surface and then we touch these objects and touch our face, that can also lead to infection. COVID-19, unlike flu and colds typically, can occasionally be airborne, which means that it can linger in the air, especially in enclosed spaces, making it riskier. So the incubation period is essentially the period of time between when harmful bacteria or viruses enter a person or animal's body and then the effect of a disease appears. For influenza, this period usually is 1 to 4 days after exposure. For a common cold, we may start feeling unwell about 1 to 3 days after catching exposure to that virus. So I'm going to talk a little bit more now about some of the symptoms and how they're similar and different to each other and COVID-19. So again, if we're using an analogy of winter storms, the flu may be an unwelcome winter storm that can have a range of symptoms. Just like storms can vary in intensity, so can the flu. So common symptoms are like the typical symptoms of a winter storm. They're expected, but still disruptive. Fevers and chills, cough, which may be persistent and dry, sore throat, it may hurt to swallow, talk, runny or stuffy nose, which is similar to all of the illnesses, muscle or body aches, like a feeling like you've done a heavy workout, even if you haven't, headaches, and fatigue. Kind of similar feeling to being out in a storm too long. Less common symptoms, and these are kind of the occasional surprises a winter storm might bring, may include things like vomiting and diarrhea. It's more common in children, but occasionally can occur in adults. So the severe symptoms, these are kind of like the emergency signals, the severe warnings during a major storm. So if you or someone in your family or someone you're caring for shows these signs, you'll want to think about getting more urgent medical attention. Difficulty breathing or shortness of breath, pain or pressure in your chest or abdomen. If you're dizzy, unsteady, lightheaded, if you're confused, not being able to think clearly or feel alert, severe vomiting, and flu symptoms that may improve, but then get worse after a couple of days and may return with a fever or cough. It's like the storm seeming to pass, but then coming back with a vengeance. Those are some of the warning symptoms that I think about with the flu. And just keep in mind that older adults as well as children may not show some of the typical symptoms. And so they may have worsening of chronic conditions like heart disease, asthma, or diabetes, as well as a non-specific weakness or dizziness, feeling unsteady without any clear reasons. So now I'm going to talk a little bit more about symptoms of common cold. So again, with the storm analogy, common cold is like the brief rain shower. It's mild. It usually passes on its own, but it still can be bothersome. It's not as intense as a storm, but it's important to recognize the signs and manage them appropriately. So common symptoms like of a cold are like the light drizzle during a rain shower, stuffy nose, sore throat, cough, which usually is mild and dry, mild fatigue, a bit drained or tired, sneezing, a mild headache, or maybe even watery eyes. Less common symptoms, so they don't always accompany a cold, but can occur, like a gust of wind during a rainstorm, may include a low-grade fever, which is more common in children, occasionally in adults or someone who's older, mild body aches, but not as severe as with a cold, and more like a generalized feeling of discomfort, and a loss of appetite. So may not have as much desire to eat as typical. And severe symptoms can occasionally occur, especially in someone who's older or has a weakened immune system. And this could be, again, the sudden downpour during a otherwise light rain. This may be a higher fever, shortness of breath, or persistent worsening symptoms. So again, the idea that you're doing a little better, but then all of a sudden symptoms get worse. Chest pain or pressure, or underlying worsening of a chronic condition like asthma or heart problems. Someone who's older or may have a weakened immune system may have a longer recovery time to feel better, and may also have higher risks of complications like bronchitis or sinusitis. So even though common colds are usually mild, it's important to recognize the symptoms and to take them seriously, especially for someone who's older or has a weakened immune system. And if there's any doubt whether symptoms are severe or mild, talking to your healthcare professional. So there's different ways we can defend against some of these infections. So vaccines, Dr. Segretti already talked a bit about the COVID-19 vaccine. We'll also talk about wearing masks, hand hygiene, distancing or avoiding indoor crowded places also help to offer protection against illness. So flu vaccine, which again, I know has already been talked about a little bit, is important because the flu can hit harder, especially people who are older or have compromised immune systems, and can eventually lead to complications like pneumonia. So the flu vaccine trains our body to recognize and fight a flu vaccine virus. And these vaccines are updated each year to combat the most common strains that are noticed in Asia. Usually we recommend getting a flu shot before the flu season starts in the fall. But if you haven't gotten one yet, it's not too late. And I would definitely recommend getting one if you have been putting it off. So for common cold, while the symptoms are usually mild, there isn't a vaccine available. And this is because the cold can be caused by numerous different viruses, making vaccine development challenging. But while there's no good vaccine, we can participate in good hygiene practice like hand washing and avoiding close contact with sick individuals to help prevent the cold. Again, always discuss with a doctor or pharmacist about which vaccines are suitable and when, and be aware that these recommendations can change from year to year. New vaccines or boosters may become available. And while some vaccines may have some mild side effects like soreness at the injection site or mild fever, these side effects are generally short-lived, and they're a sign that our body is building protection. So Staying informed and vaccinated is an important step in a healthier, safer winter. So hand hygiene is also essential in preventing transmission of infections. Our hands are the first point of contact with germs. Keeping them clean reduces that risk of infection. Older people, people with compromised immune systems are more susceptible to illness, and proper hand hygiene can prevent these infections. So clean hands mean less germs to spread, which protects not just us, but the community, our loved ones, and caregivers. So washing hands after using the restroom, before eating and preparing food, after coughing, sneezing, or blowing one's nose, after touching garbage, before and after caring for a sick patient, and after handling pets or cleaning up after them are times that I would prioritize hand washing. And when you do hand wash your hands using soap and water, wetting your hands, then applying soap, scrubbing for 20 seconds all parts of the hand, palms, back of the hand, between the fingers, under the nails, and even thinking about humming a happy birthday song twice to make sure you've washed long enough, usually amounts to that 20 seconds. Then rinse with clean water to wash off the soap and dry your hands with a clean towel or air dry. Hand sanitizers are an alternative to be used if soap and water is not available. And the hand sanitizer ideally should have 60% alcohol. And with the hand sanitizer, apply it to the palm, rub hands together, and cover all surfaces until it feels dry. This is especially important for family members of people who are at higher risk of infection. Showing and demonstrating proper hand hygiene can serve as a reminder to children and older adults who might forget or overlook the importance. So it serves as a good reminder. And in addition, remember that sinks are easily accessible. Make sure soap is available, towels are within reach, and for those who have mobility issues, hand sanitizers are nearby. Hand hygiene really is one of the simplest but most powerful tools in our arsenal to help prevent against cold and flu in the winter, and other illnesses as well. So Dr. Segretti talked a little bit about the idea of social distancing, which of course was much more prevalent in the news at the times of heightened of COVID-19 and significant community spread. So while social distancing term isn't used as frequently, Dr. Segretti's point of avoiding crowded, poor ventilated places, trying to be outside instead of inside is especially important this time of year. Where our immune system's efficiency may decrease if we're on certain medications or have certain health conditions, if we're older, making us more susceptible to infections. People with chronic conditions like heart disease or diabetes or respiratory issues can exacerbate the effects of these illnesses. And some respiratory infections are more severe implications for these people, including higher hospitalization and mortality rates. So when you're with family members who are particularly susceptible, or for yourself, making sure you consider using a mask, depending on the situation and your values. Following, again, lead of your family and having kind of a shared understanding with your community. And consider, especially in the winter, phone calls or video chats or writing things, emails. Maintaining social ties is so important, but trying to avoid those busy, crowded places is as well. So next I'm going to talk about how nutrition and exercise can also help keep us healthy in the winter. So diet is crucial for a healthy immune system. Fuel for the body. A balanced diet provides essential nutrients that our body needs to function, including components needed for a robust immune response. So vitamins and minerals, nutrients like vitamin C, vitamin E, zinc, and selenium play crucial roles in supporting immune function. Foods rich in nutrients may include citrus, fruits, nuts, seeds, leafy greens. Probiotics may be found in fermented foods like yogurt, and these beneficial bacteria may help support gut health, which is closely linked to immune function. Maintaining adequate hydration, drinking enough water is essential for our health and helps efficient transportation of these immune cells. So making sure your family members who are at higher risk have access to nutrient-rich foods and fluids. Consider involving a nutritionist or health coach to optimize diet. Are all strategies that I typically would recommend this time of year. In addition, considering the benefits of exercise. Exercise can boost your immune response. Regular, moderate exercise can enhance body's immune response by promoting healthy circulation, allowing immune cells to move efficiently. Can reduce chronic illness risk by managing chronic conditions like obesity, heart disease, and diabetes, which already can compromise immune systems. And they're also exercise is beneficial for mental health, can reduce stress, improve mood, both of which can improve your immune function. So making sure for yourself or your family members, you incorporate safe exercise into a daily or weekly routine is incredibly important. And this could be simple as daily walks, chair exercises, yoga in front of a computer program or TV. So I at this point recommend nutrition and exercise making a world of difference in health and quality of life and prevention against some of these respiratory illnesses of the winter and a more speedy recovery. So this question came up a little bit, I know, in some of the comments. When do we seek, for Dr. Segretti's talk, when do we seek medical attention? So if illnesses are like traffic lights, a green light may mean mild symptoms that can be managed at home. A yellow light may indicate caution, when to consider, when we need to monitor symptoms more closely. And a red light means it's time to seek medical attention. So for the green light symptoms, runny nose, sneezing, mild fatigue, and slight cough. Yellow light, ones that need to be monitored, may be symptoms that are lasting more than 10 days, or the symptoms that start to improve, but then they come back or associated with more fatigue. And the red light symptoms are those that may involve difficulty breathing, chest pain, or symptoms that interfere with daily activities. High fever, dizziness, confusion, vomiting, being unable to stay awake due to fatigue, or bluish face or lips. Those are all times where we would need to get help sooner rather than later. So being informed of each of our different illnesses may help us understand what we're dealing with and when we need to seek help based on our symptoms. So we recommend communicating with your doctor, communicating with family members, making sure that everyone is comfortable and has a support system to discuss these new or worsening symptoms. Consider using telehealth services for consultations. I know this is something that Rush has and will be continuing to develop throughout the next several months, so that a physician or health professional can determine the severity of the situation without the need for immediate physical travel. And certainly, if you have severe symptoms, don't hesitate to call emergency services or go to an emergency room. While mild symptoms can be managed at home with rest and over-the-counter remedies, those red light symptoms need medical attention and can make a significant difference in recovery and outcomes. So your doctor will decide if you need to be hospitalized based on these symptoms. They'll decide based on how you're feeling. Are you having a hard time breathing? Are you feeling pain in your chest? You have a fever that won't go away, or you're particularly weak, confused. Those are some of the signs your body is really struggling with the illness. They'll consider your other health conditions. If you have other health conditions like diabetes, heart problems, lung problems, then we also may need to be a bit more cautious. And these comorbid conditions can make it harder to fight the flu or cold. Sometimes a flu or cold can lead to pneumonia, which is a bacterial infection requiring antibiotics. So while these viral infections do not require antibiotics, a pneumonia, which you can get as a consequence of a virus, can. So if your cough is becoming worse, or you're developing a new fever, those are times, again, we may need to consider hospitalization. If you've been resting, drinking fluids, taking medicine, and you're not feeling better or you're feeling worse, that may also be a sign you need more help than what can be done at home. Finally, it's important to think about the person who's taking care of you. If they're sick, they may not be able to take care of you properly and could pass the illness to you. And think about your home. If it's hard for you to take care of yourself there, if you don't have enough help, going to the hospital may be safer until you're better. And again, it's always okay to call your doctor if you're not sure what to do. Your physician can help you decide if you need to go to the hospital or if you can stay home and get better. In addition, this was mentioned from Dr. Segretti, and I've kind of alluded to it here as well. The flu has antiviral medication that can be useful. COVID has antiviral medication that can be useful. So seeking attention for those antiviral medications is important this time of year. So in summary, each of these illnesses may have different but also overlapping symptoms. The accurate diagnosis can help us decide how to treat and how to contain the illness. Being informed about some of these different symptoms may help you decide when you need to get medical attention when you're entering the yellow and red light symptoms. When in doubt, CDC and the WHO also have guidelines published for prevention and treatment. These sources, your healthcare providers, Rush information are all reliable sources of information in the future. And that is all I have. I'm open to taking questions at this time.
Thank you so much, Dr. Sweet. That was a very comprehensive information on cold and flu health. And I really loved at the beginning too, the analogies with like the garden and storms. And that really just provides like, an easy visual for us to understand the concept symptoms better. So thank you. For those who have called into the Zoom meeting, feel free to unmute yourself by pressing *6 to ask Dr. Sweet any questions you have. And then following that, we'll read the YouTube questions that have come in. And while we're waiting to see if any callers have questions, there is one question that came in the middle of your presentation, and it was asking, if you do not choose to get the flu shot, can masking and washing your hands prevent you from contracting influenza or the common cold?
They can't prevent it alone, but they can certainly help. So they are certainly good strategies to abide by if you can't get a flu vaccine or choose not to. They can definitely help, but alone are not adequate to entirely prevent the flu or cold.
Okay, thank you for that. And when it comes to the flu vaccine, how can we be certain that we're actually getting protection against the type of flu that is being spread, during a particular season?
So the scientists who developed the flu vaccine look to Asia and Australia in the summer, and usually the strains of flu that are seen in the other part of the world, in the eastern parts of the world, then travel here. So our flu vaccines are based on that information. And some years we're better at predicting than others. So many of you will have heard in the news that this year they are a good match. This year they're not as good of a match. So sometimes it's hard to know early in the flu season how good of a match this year's flu vaccine is for the circulating strains. But the downside is relatively low in getting it, and the benefits can be quite high. Even if someone develops the flu after getting a flu shot several months later, symptoms are often less severe than if you did not get a flu shot.
Gotcha. Okay. So even if it's not, kind of a perfect match for what might be going around, there is at least more protection than if for those who may not have received the vaccine.
Yes, absolutely. Similar to COVID in that regard, where people with COVID vaccines still may be at risk of getting COVID, but one of the concerns is preventing complications and more severe disease.
Okay, yeah, that makes sense. Thank you. And another question that came up was if when you were talking about the symptoms of the cold and flu, and said that in older adults, sometimes the symptoms can look a little different. What are like some of those maybe different symptoms that may not be kind of those typical ones to expect?
So those include things like maybe more confusion, more weakness. So it may not be the typical runny nose, but my family member or my loved one has been sleeping a lot these last few days. So vague symptoms like that. Occasionally, it may be a symptom of their underlying illness. So someone with heart disease is having more heart symptoms, and we realize it's because they have an infection that's causing their underlying disease to act up a little bit. So those would be more of the atypical presentations that someone who's older may have.
Okay, very fascinating to hear that, but helpful too. And so, let's say that there is somebody who is experiencing like worsening heart symptoms. Should they go to their cardiologist for that, or do you recommend them seeing another type of provider to help?
It depends on the symptoms, but often for these patients, they may be more sick, in which case seeing a physician sooner. So if they can get an appointment at a cardiologist, that might be fine, but going to a emergency room or their primary care doctor who can help, and urgent care, wherever they can get help soonest would probably be beneficial. So again, a family member who's been sleeping a lot more. Normally they don't, but in the last 3 days they've been sleeping more. That's a time to get help and to see if it is one of the winter viruses that's causing those symptoms.
Okay, yeah, that's good to know. And
Hello.
oh yeah, go ahead,
Hello.
Paula.
Yes.
Hi, I have a question about the COVID shot. So I know that like this year, thank you, Dr. Sweet, for your information and explaining to us, in details about all these, different illnesses, in winter time. So my question is more specifically about the COVID shot. So I know that the COVID shot is not, mandatory anymore. It's optional, and all my family members have gotten the COVID shot this year, and they became really ill for next couple of days, So, they've been staying in bed, and they had this like really bad, symptoms from the side effects of the COVID shot. So I opted, not to take the COVID shot, but I have a family members, living abroad, and I will be traveling abroad over the Christmas break, and I'll be around, elderly, people, elderly a couple. So I'm wondering, would you recommend for me to get the COVID shot despite this such a bad side effect? Because I don't want to be down for the next few days, or can I still opt out of getting the COVID shot?
So ultimately, it has to be a personal decision based on your risks and the risks of those around you. So the benefits of the COVID vaccine, certainly there may be side effects that you've mentioned that are associated with it. But if you have a family member or someone who you're going to be around who's at very high risk, Dr. Segretti detailed some of those risks. So older adults, people who are obese,
Yeah.
people who have underlying disease, those are the patients who are at highest risk of complications. And so if you are going to be around people, if you yourself or are going to be around people with those higher risks, then being protected is a benefit for you and them against that more severe illness. But you're in the best position to know what are your risks of COVID and what are the risks of those around you. So,
Okay.
so the symptoms certainly may be there for some people after the vaccine, but the disease can also be very severe.
I see. Yeah, I mean, for me, I don't, luckily, I don't have any pre-existing conditions.
Yeah.
So my other question, like a travel by, on an airplane, does it increase the chance of catching the COVID?
So kind of like Dr. Segretti and both myself have alluded to a little bit, it's the problem with airplanes is it's a enclosed space without good ventilation. So enclosed spaces without good ventilation are are higher risks for any type of infection. So cold, flu, and COVID may be more prevalent with airplane travel just because there isn't that good ventilation and there's a lot of people that are breathing that poorly ventilated air.
Yeah. I mean, would wearing masks will enough to address that, or would not be sufficient?
I mean, wearing a mask would certainly help with that, yes. And is it sufficient? really becomes a kind of risk benefit. So it depends on the mask you're wearing. An N95 is better than other masks. It depends, is your mask on the whole time, or are you taking it off at various points to eat and drink? So a mask that's on, an N95 mask that's on, that's well fitting, that remains on for the entirety of that period where there's poor ventilation, certainly will significantly decrease risk of respiratory viruses.
I see. Thank you.
Sure.
Those were great questions. Thank you so much for those. One last question. We have heard that there are home COVID-19 tests and like the importance of testing to see what we may have contracted. Are there ways to test at home as well for influenza?
To my knowledge, it's much more difficult, unfortunately. I think there are a few companies that will offer via mail, and if you have insurance, depending on what insurance you have, will send you a test. You can send the test back and several days later find out. Most of those aren't as efficient. To my knowledge, there's not approval in this country of home flu tests. So most of these tests need to be done at an urgent care, a physician's office, or in an emergency room. All of those locations will have these tests more readily available than at home or at a drugstore.
Okay. That's good to know, because I know sometimes we're like, okay, we don't want to go into an urgent care if not necessary, but that's interesting to know that there are maybe some flu tests approved in other countries, but just not locally to us.
Yes.
Yeah. Well, thank you so much, Dr. Sweet. This is just a wonderful presentation and very easily applicable for us to know what symptoms to look out for, when to seek medical attention, and what's within our control to help boost our immune system and stay as healthy as we can this holiday season. So thank you so much.
Sure. Thank you.
And for the last couple minutes that we have in our time together today, just want to go over a few brief opportunities that we have with Rush Generations and the programs that we have coming up, as well as our next lecture. So let's see here. Our first opportunity that we want to highlight is a volunteer opportunity. If you or someone has been diagnosed with a chronic health condition or disability, it offers you the opportunity to collaborate with a team of healthcare students to create and work towards a personal wellness goal. And you, as a community health mentor, will receive telehealth training, so training on how to use or how to access healthcare by your phone or tablet. So you'll receive telehealth training and a gift card stipend for your participation. And there are 3 dates that this will be held. That would be January 24th, February 14th, and March 20th. So please call us. We would love to have you join this great opportunity. So many participants have just found a lot of benefit from this in regards to achieving a health goal that they have in mind. So to get more information, please call our 800 number, which we will, which is on the slide here, 800-757-0202. And next is our Senior Connections Friendly Caller program. If you or someone is feeling lonely or socially isolated, especially around this time of year, we would encourage you to reach out to get more information or to register for this program. This connects you with a trained volunteer for weekly phone calls. And the calls are just designed to be whatever you would want to talk about that day. There's no structured questions or anything that needs to be done. It's really just a time to connect with someone else. So if you're interested in getting connected with someone, please call our 800 number to get more information. And then, as always, we have our Shulman Senior Voices, and this program aims to empower older adults to discuss what matters most to them as they age. And we do this through collecting videos of older adults sharing their reflections, whether it's what matters most to them, or even what they learn from a lecture like today, what you've learned about COVID-19, cold and flu health, and how to stay healthy this winter season. So if you would like to record a video, we would strongly encourage you to do so. And you can do that by the web link that we have on this slide, or by scanning the QR code with your phone. And our next lecture will be on Wednesday, December 6th, and we'll focus on hearing and vision loss. And we'll be talking about what are some of the normal changes to expect with aging, and some things that, you know, aren't normal, and when is it important to go to a doctor and get an evaluation. And if you have experienced some kind of hearing or vision loss, what are the treatments that are available and resources. So we would love to see you again for that upcoming lecture. And finally, as always, our 800 number here, 1-800-757-0202, and this is available for you to call with any questions that you have about today's lecture, about the programs that you've just heard about, or, you know, if you just want to reach out and get some help about something, we would love to hear from you and try and get you connected with those services. So thank you so much for your time and attention today. Appreciate you spending this time with us, and hope you stay healthy until our next lecture. Thank you.